Dr. Barry Kistnasamy, the convener of the National Occupational Health and Safety Committee, joins us now via Skype. Dr. Barry, very good evening to you. Thanks for joining us. Welcome to the Globe.
Good evening, Simpiwe, and your listeners.
Well, 13 people testing positive, is a very, very worrying figure, especially if they all work in the same mine. And, well, it's believed that they may have contracted it outside of the province. So what do you think, what kind of stringent measures do you think every mine in South Africa should take in order to ensure that, mine workers in particular, are safe from this virus?
Well, Simpiwe, all workers, we need to look at precautionary measures and preventive interventions. Mine workers by themselves are particularly vulnerable for various reasons. And fortunately, the Department of Mineral Resources and Energy has provided a government notice outlining the measures to be taken by the mining sector. And Department of Employment and Labour has provided a government notice covering the non-mining sector. And lastly, the Department of Public Service and Administration has covered the public service. But in general, the preventive measures are really that the mines ought to do a risk assessment. And as with other employers in the non-mining sector and the public service, and linked to the risk assessment would then be looking at high transmission areas versus low and medium transmission areas. And based on that, then interventions to take place. As pointed out by your previous news report, very important is a concept called symptom screening and then targeted testing. We do have a backlog at the moment with the laboratory testing, so one of the issues that the Department of Health is looking at is how to increase the yield in terms of targeted testing so that we can actually get a better yield in terms of positives. And at this moment in time, because we don't have any rapid test kits in the market, we have to rely on the PCR test in terms of positives. So it is worrying that with the movement of the country in terms of the lockdown 5 to 4, and particularly the opening of workplaces, that we do have the numbers of workers that are testing positive. So preventive measures are very important, and what we call in non-pharmaceutical interventions, that's the social distancing, the personal hygiene measures, the cough etiquette, the hand washing practices are very important. And then control factors that would come from the risk assessment that would be put in that helps with non-contact surfaces and issues around wearing personal protective equipment if we can't put in control measures like barriers, etc. So there's a range of interventions, and we're working very closely with the Minerals Council of South Africa and the mining sector, and then together with Business for South Africa, with the private sector, particularly the formal workforce, in terms of interventions in the workplace. There's various risk assessment tools that should be undertaken by highly competent colleagues called occupational hygienists, but there are also tools that we are working with the shop stewards and trade unions in terms of working a bottom-up approach. Of course, the last resort is personal protective equipment in terms of respiratory, well, the cloth mask in the first instance, which is not a personal protective equipment, but just helps in terms of the community level type activities, and then personal protective equipment like the N95 respirators in high transmission areas, coming lower down with different types of what we call surgical and medical masks, FFP1, FFP2, and FFP3. So these are some of the measures beyond the personal hygiene and the public health measures. And of course, very important is behavior change about a range of issues that we should undertake in terms of protecting ourselves as well as people around us. And then linked to the process is contact tracing once we find a positive. And I'm sure colleagues in Limpopo are already beginning that process about contact tracing. And the key area, whether the transmission was at the mine or whether the transmission was at the community, I don't know enough about the details, and I'm sure that colleagues in the Department of Health are following up with the implants, the mining, the mine itself in terms of the processes to take forward. And then lastly, we consider what's called a return to work assessment prior to the mine worker who is tested positive returns to work. So these are some of the measures in the continuum of care. We must emphasize prevention, as opposed to stop-starts. And one of the issues, of course, is the whole issue about quarantine for 14 days. Part of the discussions are around the returning of neighboring country mine workers, and there is a program on the place that should be finalized later this week about the issue about returning mine workers and other workers in terms of the issue around quarantine facilities and also coming through border posts, etc. So those are some of the steps. Firstly, the regulatory framework is in place. And secondly, we think it's both a moral framework and imperative that workers and management come together, particularly trade unions, government, and employee organizations, in this case, the Minerals Council of South Africa, about how we flatten the curve and in some instances eliminate and mitigate the spread of transmission of SARS-CoV-2, or what we call the coronavirus.
Now, Dr. Perry, the government has flagged the mining sector as a potential breeding ground for the spread of the coronavirus. And now that mines are allowed to operate at 50% capacity, now, given the latest figures of 13 miners testing positive of coronavirus, and the Mineral Council website showing that 23 cases to date in the industry, and that is 7 in the platinum mining sector, as a precautionary measure, do you think that mines should continue operating at 50% capacity? Or should that figure be reviewed?
No, one can't comment on whether it's 50 or 100%. I mean, you can take processes. I think what we should rely on is the epidemiological evidence. If you could take parts of the Northern Cape, which is also a high mining province, there's a low incidence of cases of COVID-19 in that province. So if you have to take a place like Ottazal, where there's the big manganese mine, where there's 0 cases, it could operate at 100%. So I think one has to look at the risk factors, look at the current epidemiological intelligence per ward or district. As our minister has said, that we want to get to below the district and below the provincial levels, get to deeper figures, and then make decisions about, together with the economic cluster, Department of Trade and Industry, and the sectoral ministries that are involved, in this case, Department of Mineral Resources and Energy, to actually decide on what you open, or as we call it, the alert levels, in terms of the moving the gauge up or down. So 50%, I think, has come through the Ministry, Department of Mineral Resources and Energy, and of course that would be varied depending on ultimately how you take a risk profile, and then determine the issues around, is it 50% into the production or 50% in terms of numbers of workers. And I don't think we should just stigmatize the mining industry. I mean, there's also manufacturing, there's agriculture. I think we want to get the whole of the economy moving. But the key area is very critically to do the risk assessment, look at the epidemiological intelligence and the data that's coming through in terms of that ward or district, and then working out transmission patterns and where do we intervene that gives us the greatest values in stopping transmission. For example, we have to consider for the Eastern Cape, as we know, that funerals have become part of the transmission problem, so behavior change around funerals. Western Cape partly was around malls and factories. And therefore, in terms of the mining industry, or what we call in congregate settings, how do we also intervene in terms of that? So the percentages are important as targets, but at the same time doing a risk-based intervention. And the latest directive from the Department of Mineral Resources and Energy spells out quite clearly there has to be a risk assessment done.
All right, Dr. Perry, thank you so much for your thoughts. Much appreciated. That was Dr. Perry Kistnasamy, convener of the National Occupational Health and Safety Committee, joining us on the line.